Dengue is populated throughout the world, and about 3 billion people live in areas with the risk of dengue. Dengue cases are most prevalent in impoverished populations. Currently, more than half the world is at risk for dengue. As you can see in the picture, the colored areas have been reported of dengue. A study found that race may be a factor to the resistance of dengue infection, but particularly concerning for those traveling from outside a country into another country such as Africa. As for symptoms, fever is the most common symptom. That's why it's known for dengue fever. It may also be accompanied with nausea, vomiting, and rash. If an individual has severe dengue, symptoms are usually stomach tenderness and vomiting at least 24 hours and bleeding. However, the easiest way is knowing what you can do to protect yourself. As of now, there is no specific medication to treat dengue, but treatments of symptoms are available. So in order to protect yourself and your family from mosquito bites, using an insect repellent with one of the active ingredients may help, such as the one highlighted in the red box called DEET. To your right is just another example or examples of insect repellent that you can get as well. However, if these products are not available in your area, you can wear long sleeve shirts and pants along with taking steps to control mosquitoes indoors and outdoors, such as using screens on windows and doors as well as repairing the holes in screens to keep the mosquitoes out. Also, using mosquito nets may also protect you from dengue or mosquitoes. Along with proper prevention methods, education and awareness are crucial in community-level prevention. Dengue vaccinations are now available in the United States for children 9 to 16 years old for those planning to travel to these areas. Vaccinations can be educated to patients through healthcare providers for awareness. Also, education materials can be distributed to communities at risk for dengue. Most importantly, as a community, having clean water habitats to prevent mosquitoes from accessing egg-laying environments, disposing of solid waste properly, and active monitoring and surveillance of mosquitoes to determine appropriate and effective control measures, making sure the environment surrounding communities are managed to prevent egg-laying habitats, having policies in place for the improvement of vector control, and applying insecticides are other ways to control the disease. In conclusion, having multiple organizations to target communities at risk with awareness and education of the disease, as well as policy changes to improve infrastructure of vector-borne habitat, are crucial to reducing the disease. Having better evidence-based programs to help target communities in need of protection from the dengue virus and developing new tools such as insecticides products to prevent mosquitoes in the environment is crucial as well. Thank you.